buttons throughout the app. Just remember the blue button. Yeah. Yeah. Okay. The first activity helps you learn about your brain health risk. Don't worry, don't panic, go at your own pace. And while you're doing that, our team member Jay. Sylvia Health was founded in 2020. I was in my third year at medical school. My grandma got diagnosed with mild cognitive impairment, which is the stage before dementia. As a caregiver, I was amazed by the fact that there's no cure for that stage and there's no any standardized care services. So I came up with the idea of leveraging digital technology since we thought that maybe digital technology can help my grandma manage her cognitive health herself in an enjoyable way.
One of the biggest challenges in communities in the UK is the provision of adult social care, where we know we have an increasingly ageing population. We know that an increasing ageing population comes with a greater complexity of care needs.
We're seeing lots of challenges with people having falls at an earlier age, kind of some of those really complex health inequalities that are hitting our populations much younger.
We have recruitment issues, financial challenges. Also, people sometimes look upon care homes as the last place they want to send a relative, which is really sad.
We need to look at new ways of working that is more effective, but also cheaper. For me, part of that is how we use technology. Social care has been behind the curve in regards to digital technology in the past, and I'm really keen to be at the front.
I am Dan Avery. I'm part of the leadership team in Rainmaking Europe.
I'm Tom White, I'm the Innovation Director for the Thames Freeport.
My name is Matt Skinner. I'm the Chief Exec of Care City, a community interest company based here in Barking, Dagenham.
I've been a part of the Adult Social Care Accelerator from inception through to now. The Adult Social Care Accelerator is a really interesting pioneering program founded by Thames Freeport. And fundamentally, we exist to improve the health spans of adults and the population that's aging within the region. The secondary but really important benefit is through driving a technology ecosystem.
We've partnered with Rainmaking and Care City to go out and recruit those high maturity innovative businesses to come to our region to work with us, where we will help them understand the UK market opportunity. We'll help them access market opportunities in the UK, demonstrate their products and their capabilities, but most importantly, prove the impact they can have.
You know, we've found some technology based on a real need that we've seen in our population. We've gone and sourced that technology, and now we're testing it in a really kind of lo-fi way, but to really understand what the types of benefits might be.
Part of the reason I get involved in pilots is I think it's really important for social care providers to be willing to try things. There'll be stuff that doesn't work, but in almost everything you try, you'll find a positive within there.
My name is Wesley Scott. I live in Barking and Dagenham, and I have a PhD in accessible design. It's really important to test with users that have additional needs because they can give you context and other things that you might not have thought of.
This one?
We had a chance to test our product in local community here to see whether the end user really see any value from our products. We had our own hypothesis before we get into that room. Maybe we might need to make whole new content for people in the UK because of the cultural barrier. But we found out that our content had no problem with the culture stuff.
I've very much enjoyed the games part of it with brain training and things like that.
The one about like testing your brain and that sort of thing is very good. It just needs a big impact.
I've got a friend that's got onset like dementia, and I do what I can to help him. Yeah, I think it would benefit them. It would.
I need your signature to return it.
Oh, okay.
As you know, in Korea, there's lack of managers and staff members, so they cannot look after the patients in the remote site, especially the senior member who live alone. Our AI smartwatch can analyze the behavior of the patients, especially when they are taking the pills or what kind of pills they are taking. With this data, we provide the personalized healthcare services.
As a first potential customer, we managed to meet AppCross, who agreed to go through our pilot program. Our product is based on the radar sensor, and that radar sensor detects the heart rate and the respiration, and it monitors 24 hours a day. It's small, but you can notice 4 different colors here. Wherever the resident goes, it shows the activity.
Obviously, with the amount of people that we have in the home, you can't be in everybody's room the whole day.
Yes.
So it's good if they're unable to vocalise, use a call buzzer to say that they're feeling unwell. This is a really good indication that something may be going wrong, that we can get there and deal with it. So, looking at the technology today, it was great to see that potentially we could have that reassurance for the nurses monitoring on their laptop while they were sitting doing some of their other additional paperwork, to know that the person that's in the room is continuing to be monitored.
It will give residents peace of mind. It will also give the nurses, the carers, management peace of mind that people are being looked after 24/7.
Using technology for something as simple as identifying that a resident's got up twice in the night when they would only normally get up once, that is going to enable us to test, and then we can get treatment before they've had the fall.
In a short amount of time, to have worked with several different really innovative organisations from South Korea on the Adult Social Care Accelerator has been amazing.
They have been great at introducing me to the right people to talk to in the UK. So we have been introduced to GP, memory clinic, as well as care homes. We spoke with the NHS board.
The ability to kind of really quickly scout, bring that innovation into the UK, and then to test it in 9 weeks or so has just been enormously beneficial, not only for the people that have benefited from using that technology and continuing to use that technology, but also for us in terms of learning, like what else is sort of possible, I guess, in terms of innovation around technology in this space.
Great. Thank you very much.
There you go. Well done. Thanks very much.
Thank you.
What I'd really like to see, I guess, in terms of how this all moves forward is for the kind of pipeline of innovation, the kind of Adult Social Care Accelerator that we've begun to continue. I think we've got some real engagement from the local authorities in the Thames Freeport region. We're working with Care Providers Voice locally, who are kind of helping us to test technologies with the independent care sector. So hopefully the Social Care Accelerator is just the start of a lot more to come in this space.
Obviously, a great result for us is that through working with our technology project partners, some of those businesses then start to look at establishing a base in the UK or bringing parts of their supply chain to the UK to serve that market.
We're trying to expand the user base to other countries, including the UK. We hope to get around 5,000 registered users who are living in the UK. That's actually our ambitious goal this year.
We only really start to make a material difference when we take a solution from being trialled at 5 or 10 homes and turn that into 10,000 homes or 25,000 homes.
We think most impact can be had by being preventative and predictive. We're seeing a huge amount of solutions from across the world, actually, different regions, coming forward to help us to do this across areas like dementia, physical health, diet, exercise. So, I would love to see us build upon the platform that we've got here, and, from here we can scale out to the rest of the UK and hopefully, have a really positive impact on how people age and age healthily in the UK.
Great job, isn't it? Great job. I think I've got it now.